Good afternoon. We have some very promising news today for many Washingtonians. I'm happy to announce effective Monday, 7 of our 8 regions of our Healthy Washington plan will open up in phase 2. This will mean increased economic activity, increased access to restaurants and the like. We're very happy about this. This means that 92% of all the people of the state of Washington will be able to move forward with some additional activities. Very pleased about this. The reason we've been able to do this is that these regions have met at least 3 out of 4 of the metrics of performance that our phase plan have set forth. The only region that has not been able to move forward is the South Central region. That's Ellensburg, Yakima, Tri-Cities, Walla Walla area. And we're looking forward to them moving forward as soon as possible. I want to just show you the metrics here on the screen. The metrics that have dictated this decision is on the screen, and those are the 14-day trends in new cases for 100,000 residents and new COVID hospitalizations needed to meet the metric, as well as 7-day averages for ICU capacity and % positive COVID tests. The South Central region currently meets 2 of those 4. We just need to get them over 1 more so that they can join the other 92% of the state. We look forward to that. I think you've seen on this chart the progress that other regions have made. We're looking forward to that progress as well. Now, we are also very pleased. We are making real progress on the pandemic. I'll put up a graph showing the epi curve, the epidemiological curve, showing our case counts. And you'll note that they have gone down fairly significantly over the last few weeks, and we couldn't be more pleased about that. We're doing that because people have been following science. We have been masking up. Business owners have been complying with the healthy rules and being very innovative in this way. People are showing smart ways to protect themselves and their families by not having unnecessary gatherings in their homes. And because we have been doing these things, because we have been following the science, this is a large part why these numbers are going down and why we're being able to open up 92% of our state to further economic activity. So I want to thank everyone who has been part of this mutual effort. Everybody who's making these individual decisions are part of a statewide mission to save lives. And I want to thank you for being part of that mission statement. We also have good news for businesses and landlords and tenants who obviously have been having real trouble throughout this pandemic. I'm today authorizing the Department of Commerce to distribute an additional $87 million for additional rental assistance and additional business assistance. That distribution will be split evenly for rental assistance and also business assistance through the state's disaster response account. We need to use this funding to keep our relief efforts going while we're waiting for further federal assistance. So this is neither the first nor the last time that we have been putting funds forward to help tenants and help landlords and help businesses. Commerce has previously distributed $110 million to more than 30,000 households in the state of Washington through our rental assistance program. And obviously we're talking about people who've been severely affected by the pandemic and can't pay right now. Obviously anyone who can pay, we encourage them certainly to do so. But this funding will continue our eviction rental assistance program until new federal assistance arrives. Now, business assistance, we're also very happy about this. We'll have this additional $43.5 million going for business assistance grants that can be used by businesses to provide for measures associated with the pandemic. These funds can be used for rent, for mortgages, utility assistance, technical assistance, and to help prevent permanent closure of these businesses. It's not alone what we're doing. Since the pandemic began, Commerce has provided about $200 million for businesses and for nonprofits assistance. And additionally, more relief is on the way. The legislature has now passed a $2.2 billion COVID relief bill that combines state and federal dollars. And this will include $325 million for additional rental assistance and another $240 million for business assistance through the Working Washington Grant Program. So today is a very good day for being able to have businesses open and customers being able to have more access. It's a good day to give some financial assistance to these hard-hurt businesses that have been so innovative. And to talk about further efforts, I want to turn this over now to our Department of Commerce Director, Lisa Brown, who's been leading these very aggressive efforts to help our business community. Lisa.
Thank you, Governor. And yes, we all know that over the last year, the pandemic has taken its toll both on our health and on our economy. So we are very grateful to your office, the Office of Financial Management, and the legislature for working on coming up with these additional funds, because the needs that thousands of businesses and families have felt have outstripped the resources. So this is greatly appreciated. Commerce will be administering these funds with our partners around the state. When it comes to business assistance, we have economic development partners in every county of the state. When it comes to rental assistance, housing, homelessness, we work with local governments and nonprofits. So we'll be working with them to get the word out. The rental assistance in particular is particularly important as a bridge, as you mentioned, between previous rental assistance funds and as we put in place the new funds that the legislature has just passed the bill on. For anyone who needs help with rent, please go to our website, commerce.wa.gov. We have a housing tab there, and it will take you to a directory of your local partner in your community, and they've been doing an incredible job of getting this assistance out. And I just want to emphasize that the assistance is based on the household qualifying for rental assistance, then the funds go directly to the landlord. As for the business assistance funds, this announcement today and the action by the legislature will allow us to open up a new round of Working Washington grants, as the governor said, and this will be the biggest round ever. So we will be able to assist thousands of businesses, and the legislature has made it clear that we should look at both those who have been closed during the past year, but also affected by our reduced activity and by being a supplier or a Main Street business that just has suffered a downturn in revenue during this pandemic. And we're going to continue to look for ways to make the application process as streamlined as possible. And of course, our focus is on equity to every region of the state and to industries and communities who've been disproportionately affected by the pandemic or underrepresented in their ability to get other types of assistance from the federal government, for example. So with that, I'd simply like to say again, we appreciate this. We're going to work hard to distribute these funds as soon and as equitably as we can. Thank you very much, Governor.
Thanks for your creativity, Lisa. We really appreciate it to help these businesses. And you continue to come up with new ways to do that. We really appreciate it. I want to address some legislative activity. I mentioned that the legislature has passed a $2.2 billion relief package. I look forward to that getting to my desk as soon as it can get here. I hope to sign that next week. That's good news. So more help is on the way. Some news on our vaccination efforts. We're making real progress. We are approaching 1 million doses administered in the state of Washington. We've now moved up from 32nd to 15th in the state rankings of dosages as a percentage that have been delivered to us. We want to continue progress in this regard. We're up to 72% of our supply being administered. It's actually much more than that because of a quirk in the federal data system. But we are making huge progress in accelerating the rate of these vaccinations, and none too soon. We know to get to close to 1 million is an achievement, but we also know people have very understandable frustrations waiting for their turn in this line. And boy, if I had a magic wand to come up with 7 million doses, I would certainly use it today. And I want to thank all of the volunteers and the medical and health people and the National Guard and the community leaders that are helping us accelerate the administration of this vaccine and make sure it is done in an equitable way. I want to thank everybody for your efforts. While we are waiting for this, it's sort of like we're in a raft and we can see that Coast Guard cutter to come rescue us, and that waiting's tough. But it sure is a blessing that we have this vaccine, and it is coming quite rapidly. I have not seen the details, but I'm advised the President has made another announcement today about increasing vaccine supplies. This is ultimately our salvation. We are ready to do many-fold the vaccinations that we have vaccines today. We have the vaccinators, we have the supply people, we have the data people. All we need is the vaccine. So I'm very pleased that the federal government has been able to indicate they're going to have an increasing supplies. We can't wait till they get here. There's been certainly a shortage of second doses available, and now we are focusing on fully vaccinating those who have started the vaccination process. We're simultaneously getting as many first doses distributed across the state as we can. And as the federal government increases its supply, we obviously will see more progress. But we're pleased that people are making sure they do get these second doses, which is something the CDC certainly recommends. Now, here's some other good news. We know that even though we are now experiencing a reduction in our cases, we're very happy about this. I showed you the epi curve in this regard. But we also know there are new variants of this virus that could be more transmittable. And that means that we have future challenges possibly. But the good news, and I think this is super news, the CDC yesterday or day before announced that these masks that we wear can be super effective. And if you wear a double-ply mask or 2 masks, it can even be in the 90% effectiveness level. So I kind of look at today as kind of the Tacoma two-step. We got really great news opening our businesses. We got really great news helping our businesses. And we've really got great news on a second step that these masks can really save our lives, even in the presence of these new variants as they come on into our state, which we anticipate they will at some point. This is great news for us, because just with a piece of cloth, we can protect ourselves while we're waiting for our turn in line for the vaccine. And this is available to all of us, and I hope people will give further consideration. I think this is a moment both of celebration of our opening our state for some of our activities, and a moment for increased diligence and usage of the technology we all have. You don't have to wait in line to get a mask. So that's something I hope everybody can really focus on in the next several weeks so we can save ourselves from these new variants. Good news on the school front. We've had considerable new openings of schools that have found a way to come back in a safe way for on-site instruction. That is happening in quite a few number of schools now, because people have found a way to have safety protocols of masking of students, of distancing, of cohorting, of having hygiene and ventilation, and they have been able to come back. So this is great news. We want to encourage that movement to continue as people become more comfortable with this, as they do this in the early grades. We're confident that as more community members and educators see these successes, that this confidence will build, as it now exists in over 200,000 students who are currently on on-site instruction. So good news in that direction as well. I can't help but comment on the current discussion we're having in our national democracy. The Senate obviously is holding a trial, an impeachment trial, to see if the former president will be convicted. And I would just say, whatever view you have on that conviction, I certainly have mine based on pretty clear evidence. But what I'd like to say is I think all of us have an opportunity here to eliminate the cancer that infected our country that led to the violence in the Capitol. And that was a very dark deception that was promulgated on many people, saying that this election was not fair. And we now know it was. It has been confirmed by multiple judges, multiple Republican secretaries of state, and many, many people in the U.S. Congress. And I think the more that we get over that issue and eliminate the source of this violence, and that's something we can all help on. You don't have to be a senator or a governor to help on that. I do hope that all Republican office holders join us in just saying a really simple thing. Joe Biden was elected in a free and fair election, and he is now president of the United States. And I think the more of us that just get over that hump, we're gonna be able to unite as a nation and do some good work, as we've been doing in the legislature here this year. So I hope everybody can help eliminate that dark lie and bring a little truth to this democracy. We could sure use that right now. With that, I am happy to stand for your questions.
We'll go to Rachel with AP.
Governor, given that cases are dropping significantly across most of the state, why not have everyone move into phase 2 and then roll regions back if numbers start to climb again? And are you considering changing any of the metrics or expanding the phases soon?
We're not giving additional thought. We just made this step. It's now 10 minutes old, so we haven't revised this. And the reason we've done it this way is that we're letting the science guide us in these decisions. We set very clear, scientifically oriented guidance of metrics, and we're very pleased now that 92% of the state have met those metrics. We're hopeful the remaining 8% does it as soon as humanly possible. That is our goal. And again, I'm confident we're going to move forward, ultimately because we have so many Washingtonians who are masking up, who are being safe, who are not having dangerous parties in their homes. This is the reason that we're making progress, and I'm reasonably confident that that will continue. So we made decisions based on science. It has served us so well. We are 5th best in the United States in reducing the infection rate, and we want to continue on that path.
The Seattle Times. Go ahead, Joe.
Governor, what do you say to service workers, many of whom are younger, who won't be getting the vaccine anytime soon, and they'll be continuing to go to work or having to go back to work for many months here while this new variant spread and the pandemic still goes?
What I say is we respect your working. You're going to work today, and we really appreciate that. We have food to eat because of these workers, from our grocery clerks and our food processing workers. We get to work because bus drivers are going to work without being vaccinated yet. We have child care workers who are going to work, and those who help homeless folks. What I would say is I really respect the work that people are doing. They found a way to do this in relative safety. We appreciate that. And what I would say is we want to get you vaccinated as soon as we can. But I do believe that these folks want to have their 70-year-old mothers and 95-year-old grandmothers vaccinated, and they want those folks vaccinated. And I think that is a fairly well broadly held view that we want to save our parents and our grandparents and our great-grandparents. And the bus drivers and the grocery clerks and the folks I've talked to pretty much universally believe that. And then they want to get this vaccine as fast as they can in people's arms so we can get to those next phases of workers. And I believe we're going to do that. We are increasing the dosages that are being available to us. In the last couple of weeks, they've increased about 20%. I understand there's a new announcement by the president today. And so we are making quite rapid progress in accelerating this process. Like I said, we're approaching 1 million already. So hang in there. Help is on the way. The cavalry's coming. And we're going to get to you. If I may, just expand one more thing, Joe, because I want to just address what's really, really hard here. It's something I've experienced in many conversations. All of us today would like grocery clerks to be vaccinated. All of us today would like bus drivers to be vaccinated. All of us today would like all educators to be vaccinated. We all want the same thing. And there is a mathematical scientific principle that's really hard for us sometimes to grasp. And that is, for every person in that group that gets vaccinated, an 80-year-old doesn't get vaccinated. And it's really hard for us to kind of face that reality. As governor, I do have to face that reality. And we're making decisions based on saving lives. We believe saving lives is ultimately what you do with a life-saving vaccine. When you have a medicine that saves lives, you use it to save lives. And it is clear that this will maximize the number of lives we save, because it is that group that represents 9 out of 10 of the fatalities in the state of Washington. We are going to save lives in this state, and that's what we're doing.
All right, up next we'll go to Keith Elridge with Como. Go ahead, Keith.
Governor, many of the restaurants say they're grateful for being able to move to phase 2 in the counties and regions that are able to, but they're asking the potential of you reconsidering starting it a little earlier because of the Valentine's weekend is a huge weekend for restaurants. They would like to be open with the indoor dining this weekend. Is there a consideration of moving it up a couple of days? But also considering the fact that many of them have that indoor-outdoor open air with a huge cold snap coming. Their windows are open on a very chilly weekend.
It's something I can think about, and I will give some thought to that. There may be some procedural and legal ways we can't advance that. I will give that a little bit of consideration.
To Jerry Cornfield with the Everett Herald. Go ahead, Jerry.
Governor, a report came out, I guess today, from the Department of Health on the equity of the vaccine distribution. And in that report, there were some numbers that I wanted to ask you about, given that you just made the comments about wanting to save our parents and grandparents. It looks like 370,000 people over the age of 65 have been received one dose, but less than 10% are fully vaccinated. And right now in Washington, more people under the age of 35 have been fully vaccinated than those over 65. So I wonder if you could speak to that discrepancy in the older group, why they're not getting a second dose, and what changes are being made, if any, to improve that.
No, this is entirely consistent with what we knew was going to be the situation. There's no bad news here. Look, we started with the healthcare workers, and these are generally people who are under the age of 70. And so a younger group was in the first cohort. That was a good decision. It was good to have our healthcare workers first vaccinated. After we vaccinated the healthcare workers, and they needed that second dose as well as the first dose, we then are doing the long-term care residents and staff. That process has been slower than we would have liked because it was the federal government that was responsible for administrating that group of people, and that has been slower. The federal government contracted with 2 pharmacies, and those pharmacies have not met our expectations on how fast to do that. As a result, we have taken back some of the vaccine that went through that deployment channel, and we're putting it now into arms of senior citizens across the state of Washington. And as I've said, we have more than doubled our vaccination rate of older citizens in the last 2.5 weeks. And we now have no limits on vaccinating older people per day, except for limited number of doses we're receiving from the federal government. So this is entirely explainable by the fact that we started with the younger cohort. We had to get through them first, and now we're making huge progress of senior citizens, or people of a certain age, or people who are as old as I am.
Just to add to the governor's remarks, we opened up 1B1 for people 65 and older just a little more than 3 weeks ago. And depending on which vaccine you get on your first round, you're either coming due for your second dose this week or next week. So that data point is not surprising to us. But of course, we want to go through and finish so that those elders are fully protected.
Governor, when might we expect to know what a phase 3 could look like here and what it would take to get past this phase 2?
I don't have a date to give that to you. We certainly have been focused on this first. So I really can't give you an anticipated date on that. We will look at, when a possible next step would be, so I can give you a date. I can't do that at this moment.
Go ahead, Kayla.
Hi, Governor. So we at King 5 did a poll with Survey USA, and the results were 26% of respondents said they would not get a COVID-19 vaccine when it's available to them. So what implications could this have on the state's ability to reach herd immunity?
Well, we would like to, get to the 70 or 80% level, which the science suggests could give us herd immunity. So we would like that to be zero, actually, to get everybody have this life-saving vaccine. In that realm, we would be close or at the level the science is telling us could be herd immunity. So you might look at that as good news, that if 74% of the people do get the vaccine, then we're, then the number 70% has been used a lot by a lot of the epidemiologists have looked. Some will give you a higher number, some will give you a lower number. So if that ends up being the number, I'm not sure it's an apocalypse for us. But I do want to encourage people to get the vaccine. The science is just so clear on this. The evidence is so clear. We now have millions of people who've had this vaccine with, literally almost no really any significant adverse impacts. And we're saving, tens of thousands of lives. So I'm really encouraging people to look at the science of this. We've looked at the science in this. We've had a secondary review because frankly, we thought we needed that of our own scientists to look at this and have been very convinced of the efficacy and safety of this vaccine. Looking at the tens of thousands of people who've been in these extensive clinical trials with a very broad demographic of people who are in the clinical trial. So we just hope that increases. I will also say that I believe that as people who do have some skepticism now, it's new, so it's not shocking, as they see their neighbors and their coworkers and their relatives get the vaccine and do well, don't get COVID, don't have adverse impacts, the people who don't want to get the vaccine is going to go down fairly dramatically. I really believe that once people start seeing success here. So I'm confident we're going to get there, actually. Now, to do this, we have been trying to be intentional to share scientific information with the public, particularly in some of the demographic groups who have expressed more reluctance. So we are doing extensive advertising, sharing this information. In fact, I think in 32 languages, TV ads, print journalism, helping community leaders work with their communities, communities of color who have had more skepticism. So we have a very intensive effort to help people know the science on this.
All right, up next we'll go to Laurel Dumkovich with the Spokesman Review. Go ahead, Laurel.
Hi, Governor. I also had a question on the Department of Health report that Jerry brought up, and it kind of goes along with the point you were just making, but it also showed some pretty big inequities in the vaccination rollout, specifically for communities of color, specifically Black and Hispanic residents. So I'm wondering if you or maybe Lacey from the Department of Health have any thoughts on that and how you plan to try to improve those numbers and make sure that the vaccine is available to everyone in the state.
Yeah, a very important question. We are intensely committed to equity in the vaccine program. We've done a lot, and we're going to do a lot more. So some of the things we've done is we've tried to put our access points where communities of color are located. It's one of the reasons we established 3 of the 4 mass vaccination sites were in Eastern Washington, where you have larger groups of the Hispanic community are located. It is why we've had about $3 million appropriated already for outreach information in multiple languages and multiple media where communities of color can get that information. It is why we have increased the allocation that goes to community centers, community clinics that are in communities of color frequently, to be making it more accessible. And those numbers have gone up. Well, I don't know the exact numbers, but we have increased that fairly significantly in the last several weeks. But there is more we need to do. We want to increase that communication effort. We're looking for new distribution methods. We want to continue to facilitate local communities, local health districts to do pop-up clinics, for instance, in neighborhoods that might have had a low take-up rate. So there's quite a bit of other things we are and will want to do to increase the equity. Now, I do want to indicate, too, though, we have had some success in this regard that I want to comment on that should give us confidence in our ability going forward. I'll just pick one number. About 5%, actually a little more than 5% of the Hispanic community, the Hispanic community represents about just over 5% of the eligible population of the state of Washington. And that's about very close to the percentage of the vaccinations for second doses that they've received. So as far as the eligible population, those are people over the age of 65, healthcare workers, long-term care, people over the age of 50 who live in multi-generational hospitals. It's actually not disparate. And I just want to point that out. And one of the reasons I think we've had that relative success is we included people age over 50 who live in multi-generational housing. That was specifically to recognize that a lot of communities in color live in multi-generational housing. So some of the things we've done, I think, have had some success, but we need to do a lot more, and we'll be doing so.
Lacey, your next.
Thank you for this.
Go ahead.
Yeah, just quickly, looking at this data, and like many parts of this pandemic has helped us see that COVID-19 does not impact everyone equally, and really brought to light the existing inequities. In some cases, the pandemic has amplified them or helped us see their root causes. You can see similar inequities in hospitalizations, deaths, and cases. We published that data as well, and those are the results of structural factors like racism and other forms of repression. And as the governor eloquently described a lot of the things we're doing, I want to make sure people understand that engaging the communities that have been disproportionately impacted and historically marginalized in our prioritization and planning efforts has been foundational. We're also looking at ways specifically to address equity and how we allocate our vaccines, so what type of providers, and then using trusted messengers. So to go back to the prior question about hesitancy, we have a number of tools in, I think, 37 languages for people. We also encourage them to reach out and ask questions about the vaccine to their trusted providers so that when their turn comes up, they're ready and they understand how the vaccines work, and they are there to take it to protect themselves and to protect their families.
Yeah, if I can add, thanks, Lacey. I appreciate that. You've been leading this effort. Appreciate what you've been doing. A couple of things to add. One of the reasons we know we have to up our game on this is we are now moving into a younger group of people. We've been doing senior citizens, and the Hispanic population, to some degree, some of the other ethnic group, are a younger group. So the number of folks as a percentage of the population that we'll need to reach is going to go up, and that's why we have to increase our efforts. We recognize that. and we will do that. The second thing I will say is, I hope everybody understands, they can be a leader here. It's not just governors and public health officials. We hope people that can talk to their relatives about this and help their health and give them a little confidence after they look at the science. So we all need to pull together to help these folks.
Nick, did you have something you wanted to add?
I think Lacey and the governor covered it really well. The one last thing I would mention is that equity is a core, one of the three pillars that we are really focused on when it comes to how we focus on the vaccine allocation and delivery. And it's a big reason why we've diversified the delivery of vaccine channels that we're using to emphasize those community health clinics and those federally qualified health providers. We've also, through the Department of Health, invested in 41 different community-based organizations to try to leverage those trusted partnerships to get out messaging, to talk about how to access the vaccine and to improve access. So always more to do, and we're up to the task.
Yeah, we've allocated over $3 million to that latter effort that Nick is talking about, but we know we have more work to do.
All right, up next we'll go to Essex Porter with Cairo. Go ahead, Essex.
Governor, back to the reopening, we know that the new variant of COVID-19 virus is taking hold in our state. Why risk reopening now when you may have to just roll it back very shortly?
It's based on science, and the science tells us that we are currently driving this pandemic down quite dramatically. We are having considerable, measurable, and scientifically fact-based success right now. And we have businesses that have been suffering closed for months and months now. We have consumers who have not been able to go to gyms and restaurants to some degree, and we want to honor that. So we believe this is a reasonably scientific-based position on the current conditions of this pandemic. But we also realize that there is potential risk out there. That is why in our metrics, we built in a fail-safe mechanism that's automatic. So if in fact these variants come into our state en masse, and if in fact these numbers start to go up, this will self-correct and tamp down some of this potential transmission activity. It will be automatic. It's a fail-safe measure, and it's part of our metric, and it's an important one. So we think we're responding to the current science and protecting ourselves against future potential problems.
Nick, did you have something you wanted to add?
I think I would just emphasize that last point that the governor made about the system that we've created makes these data-based decisions. These are data-driven, data-based decisions, and the system that we've set up makes them automatically. So today, the data and the metrics show that 5 more regions can move into phase 2, and we're really hopeful that the data will show in the next review that that last region will be able to move ahead as well. But inside the system itself is the ability that if the metrics begin to go the other way, they move backward. And in that way, that's how we think of it as considering the impact of the variant and any additional changes that might happen with COVID activity. The system is really designed in a way to be able to address both ends of the spectrum, moving forward and backward.
And that does not have to happen through any action of the governor. It's automatic based on the numbers.
Up next, we'll go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
Hi, Governor. Back to the vaccines. I'm wondering, we heard from an elderly couple today from Skagit County, 81 and 65 years old, both with underlying health conditions. They'd been trying to get a local vaccine appointment that had been pushed back over and over again, all the way to April. And then they called the Wenatchee mass vaccination site, and were told yesterday they had 246 open appointments for today, so they drove there to get it. I'm wondering if we're still having issues with the amount of vaccine being sent to more rural areas as opposed to cities, things of that nature. Any idea on why that happened?
Well, I'm not sure I understand your question. You mean, why do people have to wait when we have 1.7 million people in line and only 115,000 doses coming a week? I'm not sure the nature of your question. It's because
I'm wondering why people in Skagit County were having to have their appointments for vaccines pushed back over and over again, when over in Wenatchee for the same day, there's 215 46 doses available the day before. So there was that many extra available for Wenatchee and not in Skagit County.
I think I understand your question. We're going to have these situations 1,000 times a day in the state of Washington. 1,000 times a day, someone will call a clinic close to their house and then find out someone farther away from their house has more doses available. And the reason that is these doses become available at different times. We can't predict exactly how many people will show up at the clinic at that particular time. And so the experience that these folks had is going to be replicated thousands of times a day. And I would love to tell you that we could solve that problem. We can't. And I'm just so happy that these folks did get a life-saving vaccine. It is very difficult to have an individualized decision across the state of Washington to get the right dose to the right house at the right time. Very difficult, and we're doing the best job we can. Now, the thing that I think, if I may, I think the interesting question is there a disparate distribution from county to county or between east or west or north to south? We're attentive to that. We try to keep this as fair geographically as possible. So far, we have not seen significant or persistent evidence of that, but we're continuing to look for it. Now, we also have to address this equity issue. Look, we've got to get, we got to get some of these doses where people are not having access to it for a variety of reasons. So that comes into the picture as well. So this is not easy stuff when we have 1.7 million people waiting and 115,000 doses. And I'm just glad those folks were able to get it.
All right, up next, we'll go to Casey Decker with Crime 2 News. Go ahead, Casey.
Yeah, I know there's been some concern about the speed of these metrics and the fact that some of the data points are a couple weeks old and that there was some consideration being given to various ways to maybe speed up that process. I was just wondering if any progress had been made on the ability to get more real-time data in these decision processes.
Are you referring to the phase changes? Are you referring to those metrics or?
Yeah, the 4 different phase changing metrics and getting those more real time.
Well, I don't think we're given serious consideration. I think the progress we've made today sort of proves it's working. We've made 92% of the state's population now has advances. So we're not giving serious consideration to changing that. But we always are alert to criticisms and ideas. But at the moment, we think this is serving us well. Simultaneously, following the science to protect ourselves and allowing reasonable openings. Now, I do want to reiterate, this is not throwing the floodgates open to all business activity. This is relatively restricted. It still allows only 25% of indoor occupancy in restaurants. So we think it's serving us well at the moment.
Lacey and Nick, it seems like you have answers to add there. Lacey, do you want to go first?
I can quickly add, we hear confusion and frustration about the timeliness of some of the metrics. I want to help people understand we need to make the decisions based on data that are fairly complete. So we use the metric of at least 90% complete. And the reason that's important is, when you're measuring if case rates are going down, the most recent few days, we're still getting results in. And so, that is why a couple of the metrics are a little more delayed. It takes us more time to get those data in and actually see if we are accurately able to determine if the rate is increasing, flat, or decreasing. And similarly for test positivity, positive results are prioritized coming into our data systems so that we can quickly do case investigation and contact tracing for people who have COVID-19 and their close contacts. And that means it takes a little while longer for the test positivity measure to stabilize as the negative results flow in. So this is really, we are trying to use the most recent and most complete data to drive these decisions.
All right, Nick, go ahead.
I think Lacey captured it really well. It's really important that we allow some period of time for that data to become finalized and complete in order for us to make these types of decisions. So I know that there's some headaches about the timeframes that are used for some of these individual metrics, but it is just really important that we allow the most complete data so that way we have the most accurate picture of what COVID is doing in a community.
I do want to share a truth, though, is that it doesn't matter how much data we have. If we don't have enough vaccines, we can't eliminate all this frustration that we're all feeling right now. Neither can it eliminate some of the, well, like the couple who drove to Wenatchee. They may wonder why that situation happened. It might have happened because they just opened the MaxVax site 5 minutes before they called in Wenatchee, and there were 200 slots open. And if they'd called 15 minutes later in Edmonds, it may have been able to find it. I guess what I'm saying is that the data is really not the problem here. It's the lack of vaccines that are causing our headaches at the moment.
All right, up next, we'll go to Pat Muir with the Yakima Herald-Republic. Go ahead, Pat.
Governor, I'm wondering whether the state has plans with the South Central region lagging behind, whether the state has plans to offer targeted help, whether that's could be additional vaccine allocations or additional rent and business assistance relative to the regions that are a little farther ahead.
Well, this just happened, a couple hours ago, so I haven't had a chance to think through that. We certainly will talk to local leaders if they have some suggestions about this. We'd love to talk to about them. I have talked to them, and it's one of the reasons they had some early success knocking down their numbers because of some of their leadership. They had a very vigorous masking campaign. It was very successful in knocking down. They had astronomical numbers, and they knocked them down, in the summer or some point. So we hope that they are successful in that again. We'll talk to them. We'll ask to see if there's ways we can help. But I do hope people reporting this story realize we just opened up 92% of the state of Washington. It is something that's perhaps worth focusing on.
Nick, did you have anything you wanted to add?
I would just emphasize the governor's point that we stand ready to help any region that would like help in getting COVID under control in their community, whether that's testing resources, or anything else. The State Department of Health and our staff are at the ready and at their disposal to really jump in and help with anything they need when it comes to COVID response in their community.
And we do think there's good prospects for that. And let me put, if you may, would you put up the chart? I'll tell you why I think that there's reason for us keeping our chins up here. If you look at the other regions, for instance, South Central went up 9% on their hospital admissions. They need to actually have a 10% decline. But if you look at the other regions, what they were able to do in the last couple of weeks, 14, 17, 17, 60, 17, it is possible to bring these numbers down just within a couple-week period. And all Yakima and the group needs to get down is one of these cohorts. So there's a reason to have some optimism here.
Lacey, did you want to add to that?
Nick covered it. We're here to help. I actually have had a few people email me while we're here. And, I do have optimism for that region, and they're trending in the right direction if you compare to prior reports. So for everyone in that region and elsewhere, so that we all stay in phase 2 for those that have moved and they moved to phase 2, really those 3 W's, wearing your mask, watching your distance, washing your hands, and then to the degree you can, keep your gatherings small and outdoors. And certainly if you gather, that is a great time to wear your mask and double mask, or make sure you have a really snug fit.
Time for a few more questions.
All right, up next, we'll go to Alyssa Warner with CAP. Go ahead, Alyssa.
Thank you. I was wondering if there are any plans, and I think you kind of touched on this a little bit, but specific plans to send state help to get the spread under control, specifically in Yakima, because we know Yakima kind of has been struggling since the beginning here. And I mean, clearly what's happening now is not working. So are there plans to send more hospital staff, more vaccines, more testing, anything?
Yes, as we've indicated, we'll look forward to insights from the local community of what could be helpful to them. We like to listen to the local communities to get insights first, and we will certainly do that. We know that can be successful. As I've indicated, we did that early. I went over to Yakima, had a great meeting with local leaders, and we talked about a masking campaign. It was very successful. We helped Yakima County in that regard. We could potentially do the same thing again. But I do want to reiterate the people driving this car are the people of these counties. They're driving the car. They have control over this issue. And the more that people effectively wear a mask that actually works, that's snug or doubled, the more people that don't have parties at their home or big gatherings, the more people who do that, the faster they can move forward. And it really is in their hands. The destiny of this region is in the citizens' hands. And they know that the good news is we know these things work. If more people will wear masks snugly that fit, the more people that don't go to parties unmasked for hours at a time, the more businesses that follow these hygiene protocols, and we've had great compliance with that so far, the sooner they will get to where the 92% of the state is, and we need them to do that. And it really is up to them. Their destiny is in their hands. These are not things that are based on rocket science. You don't need a physics degree or $1 million to do it. You just have to do the things we know that work. And that's really good because this virus doesn't have any legs. The only way this virus can infect us is if we let it. And I don't think we should let it. And the more people make that decision in Yakima County, the sooner we'll get them advanced.
I believe the question asked if there was anything specific that we could provide, and really the specific things we can provide are some of the things we've provided in the past to this area: additional help with testing, additional staff for contact tracing. You know, the tools to get COVID under control in your community are largely the same today as they were 6 months ago. Wear your mask, watch your distance, that sort of thing. And so we stand ready with those same resources, and they're available for any of the regions. And as has been shown by 7 of these regions, if you do those things, it can and will work.
Hi, Governor. Now that you've had 3 weeks approximately with the new administration, what have been some of the differences you've seen in dealing with the administration in terms of getting vaccine? And what can the federal government do to help with some of these issues of equity and distribution beyond just providing more doses?
Well, I'm trying to figure out how to answer this without looking backwards too much. I'll just say that, and I think every governor who is honest with you would tell you the same thing. It is really nice to have somebody who is President of the United States who is basically decent, honest, competent, caring, and tells you the truth. And that's what we have. We had none of those things under the previous administration. It cost tens of thousands of lives because of that. And I just could not be more delighted to have Joe Biden now helping all of the governors, Republicans and Democrats. And he already has done considerable by increasing dosage, using the Defense Production Act, having good relationships to give us honesty. These are kind of basic things in any partnership that you want to have, and we have that now. We did not have that under the previous administration, and it's made a huge difference. You ask what we could do as far as logistics. We try to be as transparent as possible. We try to be as responsive as possible. We try to fix things when there were glitches, and boy, there have been glitches, and I assume there'll probably be a few more. And we do that as the best job we can do. And I think we're doing, as I've indicated, we started 32nd in this. We're now 15th. We started at 32%. We're now at 72%. We're closing on 1 million doses. We're now ahead of 45 other states in our infection rate, and people are getting vaccinated. That's a pretty good day in Black Rock. No, again, I hope people feel good about the progress we're making as a state. I want to thank everybody for being part of that progress. Everybody in the state has a claim to some of these steps forward. and I know that we can continue them. I look forward to getting 100% of our state forward. I believe we can get there. So again, be well, take care in the snow and enjoy it, and hope to talk to you next week about some new subjects. Thank you.